Chancellor Folt, Provost Dean, what a wonderful day to have to celebrate, Carol, your arrival and being a part of us. In the opening chapter of Engines of Innovation, Holden Thorpe and Buck Goldstein stated, events have conspired to place our great universities in either an enviable or a terrifying position, depending on your point of view. Universities are collectively amongst the most affluent institutions in our society. They are populated with the best minds in the world, and they have created a culture that encourages new knowledge and puts it to practical use. They stated, "We believe this moment in history makes unlocking the innovative potential of our research universities a national imperative. And an entrepreneurial mindset is key to achieving this objective." Well, I'm here to say, once you hear our next three speakers, if Googling on the keywords epicenter and innovation don't already bring you to UNC Chapel Hill's website, trust me, it will soon, very soon, with our future being in the hands of such magnificent young faculty as these three innovators who will be speaking with us today. Our first speaker, Dr. William Vizuete, is an associate professor in the Department of Environmental Sciences and Engineering in the Gillings School of Global Public Health. He has been at Chapel Hill since 2005. He received his BS in Chemical Engineering at Missouri Science and Technology and his MS and PhD in Chemical Engineering for the University of Texas at Austin. The focus of Dr. Vizuete's research is atmospheric chemistry, the formation of air pollution and its connection with human health. He uses some incredibly high-performance computers to model the atmosphere to try to improve our understanding about how air pollution forms. His knowledge is used by policymakers to set standards for air quality. Millions of people in the world, as he has told me, breathe dangerously polluted air. Through his work, he is able to provide scientific advice to policymakers who make the decisions that can improve the quality of all of our lives. Dr. Vizuete.
Thank you. Thank you very much for that warm introduction, and thank you all for inviting me here. I'm very happy to be here. First, I want to apologize. I'm a little unshaven. I grew up in St. Louis, and you may or may know my St. Louis Cardinals are in the playoffs. So, of course, if I shave, they're going to lose, so I gotta not shave. Normally, I am clean-shaven, and my wife hates it when I have this beard. But anyway, so my interest is in atmospheric chemistry, and I'm in the School of Public Health here at UNC. And you may or may not know this, but we're one of the only engineering departments that are housed in the School of Public Health. It makes a very unique place here at School of Public Health. And what that means is I get to interact with all kinds of folks, from toxicologists to folks in the School of Medicine to engineers, as well as chemists and policymakers, all under one roof and all with one goal of improving public health. And so what am I interested in? Well, I'm interested in the atmosphere. And why? Because the atmosphere is out to kill us. 2 million people die every year for just breathing in the air. From breathing these little particles into our bodies, 2 million people die every year. Now, the EPA knows this, and they regulate it. And if you go, you can look up what the standard is for particulate matter, little aerosols that are found in the atmosphere. And what they found is that a certain amount of mass of aerosols lead to a certain amount of death. But about 5 or 6 years ago, there was an interesting finding that came out that showed that for the same amount of mass of particles, more people die in one part of the country than in the other part of the country, which means that not all particles are created equal. So what is it that's driving the toxicity of these particles? If it's not mass, it's something else, right? And so we set out, myself and my team, to try to figure out what is driving the toxicity of these particles that are killing people. And since my interest is in atmospheric chemistry, I naturally hypothesized of course, it's atmospheric chemistry that's driving this toxicity. And so we need to study atmospheric chemistry. Well, you may or may not know this, but over at the School of Public Health, we've been studying atmospheric chemistry for more than 40 years. And we built these huge, massive chambers, outdoor chambers, where we study atmospheric chemistry. And if you ever go over to the School of Public Health and you look up on the roof of McGavin Greenberg, you'll see one of our giant smog chambers. Now, what we can do with those smog chambers is we can recreate any atmosphere we like. I can create Houston, I can create Los Angeles, I can create cook stoves or kerosene or diesel exhaust. I can put it in those chambers and we study it chemically. We understand the particle size, the composition, and whatnot. But what we also wanted to do is connect whether those atmospheres we produce in those chambers can also lead to death and toxicity. And to do that, we had to collaborate with our friends down the road from the School of Public Health over at the School of Medicine. And speaking of innovations, one of the innovative things that they were able to do is take human lung cells out of the body and grow it on Petri dishes. And these lung cells have no idea that they're out of the body, and they act as if they're in the lung. They grow their little hairs, they do all that, right? And so we thought, well, wouldn't it be great if we could create our atmospheres and then expose these cells to those atmospheres and see how those cells respond, right? Which is better than you or I hanging out in those smog chambers and being exposed to that, right? So we got together with these folks and we took that innovation and we took our innovative ability to create atmospheres and we started figuring out how do we get these particles on these cells. Well, we looked around at the conventional methods of how we do this. And so say, for example, I wanted to figure out what the toxicity of particles in this room are. What I would do, and this is the current method, everybody does this, is I take a big high volume filter and I suck air through it and I collect the particles on a filter. I then take that filter, I scrape the particles into a solution, I then take that solution and I drop it on the lung cells. And nobody breathes like that, right? Nobody breathes through a liquid, right? And we breathe particles in the air in equilibrium with the gases that are in the air, and they deposit directly on our lungs. Now, if I wanted to study how atmospheric chemistry impacts toxicity, then I need to find out a way to measure that toxicity more rapidly than sampling all day from an air filter. So the current techniques weren't good enough, right? Because I want to know if the gases that are interacting with those particles are driving toxicity. If I put it in solution, the gases are no longer there. If I want to know if the size of the particles are driving toxicity, I can't do that in a liquid because all those particles agglomerate. And so we had to innovate. We had to think about what we were doing. So there, Dave Leith, who's an emeritus professor now at the School of Public Health, who's been studying particles and exposures for a long time, came up with a great idea. He said, I have this 1975 TSI electrostatic precipitator that we use to collect particles, right? And we thought, wow, what if we electrostatically charge these particles and use that deposit them on the lung? And so we pulled this thing out from the basement of the School of Public Health. We worked with our ESC design shop, and we milled out these things into the device so that we could place it on there. Well, fast forward to today, we were able to work with UNC and patent that technology. We're able to license it here with UNC, and now I have a company that's spun off as a result of that. And why did I decide to commercialize this device? Well, everyone I talked to said, well, we got to have this thing. This is great. We need this to get the true accuracy of toxicity. Well, I've been around enough labs around the country in my graduate work and just with my collaborators to know there are a lot of great technologies that are created in the lab by grad students and whatnot that never see the light of day. And I didn't want this technology to waste away in our little research lab. I wanted to get it out to the world. And so I took a class over, launched the venture over the Keenan Flagler School, and I had to learn all this business jargon, and I had to pitch to VCs, which is completely different training than I normally have. And they thought we had a good idea. And so I've raised a lot of money to try to innovate this idea, and we have a commercial product that we're testing right now. And so this product will allow me to sample any airstream, use electrostatics to deposit these particles, and it can house any biology. We've tested lung cells, we've tested liver cells, we've tested skin cells, right? And so you can think of it as a canary in the mine shaft, right? We have this biology that's testing everything that's in the air. We may not know what's in the air, but we know that we have this illicit response. And so we're trying to put this prototype together, and we're going to use it. You can think of uses such as communities across the street from a refinery, for example. We can't measure everything that's coming out of a refinery, nor its oxidation products. There's just too many of those things. But I can put this device there and see if there is a toxicological, biological response that's happening there, and we can identify hotspots. We can do this for bioterrorism. The biological exposures are exploding now. They have all these biology cells that fluoresce, for example, when they're activated by certain agents. And so I'm running out of my time here, so I want to make sure I give enough time for the rest of my panels here. I got 10 seconds. So in the end, so it was because of the help from the Office of Technology and Development, the help of the business school, and the fact that we're in this interdisciplinary department where I'm working with biologists, chemists, engineers and policymakers that were able to put this technology together. And I'll end with one thing. It took a long time for us to get any funding to do any of this. It was too much chemistry for the tox folks. It was not enough, it was too much tox for the chemistry folks. So all the traditional institutions of which I would apply for, it wouldn't work because we're in this kind of gray interdisciplinary area where I have all these things. Well, that's turning around now, and a lot of these institutions are recognizing interdisciplinary work.
She is an assistant professor in the School of Nursing, and she arrived at 2009 when I did. We say we're litter mates. She is currently a Robert Wood Johnson Foundation Nurse Scholar, which is one of 20 nurses across the country to be selected for this honor. She told me she started actually at North Carolina School of Science and Mathematics. So she is going to be a real product of the UNC system, you're going to hear. She has her BA in psychology from North Carolina Central University. She has a BS in nursing and PhD. Nope, BA in psychology from North Carolina Central University. She has a BS in nursing and a PhD in social health and psychology from Stony Brook University. Then she returned to the light and she came to UNC to get her Master's of Science in Nursing as a psychiatric nurse practitioner. Her research focuses on stress-related health behaviors, psychoneuroendocrine biomarkers, and sociocultural context factors that contribute to the health disparities in African Americans. I'm sure she will tell you soon about her research on the Superwoman Schema conceptual framework, which is now used across the United States to better understand health in African American women. In addition to the great work that she does as a scientist, she also has helped establish a mental health clinic program at a nurse-managed center in Durham, where she currently practices. She is the recipient of the Brilliant New Nurse Investigator Award from the Council for the Advancement of Nursing Science, and she has recently been named a leader in the field, an Early Career Award from the American Psychological Association. Cheryl?
Good afternoon, and thank you, Dean Swanson, for that generous introduction. I would just like to say I'm very happy and delighted to be here with all of you today, and very proud to represent the School of Nursing. We are top ranked in National Institute of Health research funding for our research, and we also have several faculty who have been honored and distinguished due to their leadership in nursing and healthcare in general, including our very own Dr. Marsha Van Riper, who just finished a Fulbright Award in recognition for her genomic research involving Down syndrome and families. So just very glad to be part of UNC and the School of Nursing in particular. And Dean Swanson talked about my education here in the state of North Carolina, starting originally in Person County, where I was raised, born here in Chapel Hill, but raised in Roxborough, and then I went to the North Carolina School of Science and Mathematics, as she stated, and from NCSSM, North Carolina School of Science and Math, to NCCU, to UNC, what has been emphasized to me in my academic career is service. Service was a requirement for graduation at the North Carolina School of Science and Math, as well as NCCU, and it's a huge part of the work that we do in the School of Nursing here at UNC. So first, when I was asked to be on this panel on innovation and impact, I said, well, I know what innovation means, I know what impact means, but let me just get a better understanding so I can ground what I want to talk to the group about today. So it was really exciting to think about being a scientist who's able to focus my work on innovation and impact. Innovation is defined as a new idea. Synonyms include concoction, creation, invention, even brainchild. And impact was defined as to strike forcefully, to sway, to make a powerful impact. And I thought, wow, my work as a scientist practitioner is just so exciting to be able to do this type of work. The first thing I thought about, though, when I thought about innovation and impact was collaboration and engagement, sharing diverse insights with other people who think differently. And what we get to do here at UNC is just that, interdisciplinary, multidisciplinary, and also intradisciplinary research that helps us to make feasible, sustainable impacts on our society. But then I took a couple of steps back and I thought, yes, collaboration is important, but what else is important when we think about making an impact? And what came to me was the word intention. So the question that I asked is, when I think about intention, am I best suited to do the work that I'm setting out to do? And what does it take to have intention to design research? And what I remembered was one of the things that one of my graduate student professors told us was, she said, when we're trying to design our research and we're trying to focus on what it is that we will do in our career, she said, do what you think about in the shower. And what she meant by that is, think about what do you ruminate about? What do we think about when we're not even being asked to think about something? What strikes us and we can't let it go because the idea is so important to us? And so what she meant was we have to discover our passion, because when we discover our passion, that's what's going to be able to sustain us as we do the long-term work that's going to allow our innovations to be impactful. So in the area of healthcare, some of us may consider that factors or conditions like diabetes, heart disease, cancer matter most. And these are just a few examples of very important health conditions that we're facing. And of course, all of these things matter most, but perhaps we will be most effective when we target the area or the problem that drives us the most. So once we recognize our passion, we can go back to that question of intent. And most of the time when we ask ourselves, are we suited to put forth that intention to make an impact? When we think about are we suited individually, most likely if we're humble enough, the answer is no. We have that the intention, we have the passion, but what it really takes is teamwork. And here at University of North Carolina at Chapel Hill, team science is what has become the name of the game. And luckily, the National Institutes of Health and other funding bodies have come to this same conclusion. So we have the opportunity to have multiple PI studies, and we have the opportunity to do multidisciplinary work. And so I just want to tell you a little bit about a research study that I was able to co-lead with a faculty member from the School of Medicine. As Dean Swanson mentioned, my research focuses on stress. No one in here knows about that, though, right? We don't have stress? But other people who are not in this room have stress. And so I'm interested in the contribution that stress makes to health outcomes such as obesity and diabetes. And so I look at stress and look at the two major pathways, including the effects of stress on health behaviors, but also the effects of stress on biomarkers or physiology that then increases our risk for things such as diabetes and obesity. And so I was able to collaborate with Dr. Susan Gaylord in the School of Medicine to design an NIH-funded study on stress and diabetes risk in African Americans with prediabetes. And the innovation in that study was the intervention that we chose to use. So it was a two-arm, randomized controlled, longitudinal study where we used mindfulness-based stress reduction in African Americans with prediabetes to determine if mindfulness influences stress reduction, which then increases health behaviors such as eating behavior and physical activity, but does it also change the relationships of stress, perceived stress, and directly experienced stress? Does it influence how stress leads to risk factors and biomarkers such as cortisol, vitamin D, and other things like IL-6? And so we were able to not only measure a quantitative self-report of stress and health behaviors, but we also were able to use the biobehavioral lab at the University of North Carolina School of Nursing, as well as the CTRC, which is the Clinical Translational Research Clinic, which is part of NC Tracks here at UNC, to do this research. And so we're currently analyzing our data, and I hope to be able to report to you that our findings really show that mindfulness meditation is something that reduces stress, which there's a lot of research that demonstrates that already, but that it might be a viable option for reducing stress-related health disparities in this population. And so luckily I get to work with students, and one is in the room today. Her name is Ms. Anusha Smith. I'm going to ask her to stand. Anusha is a graduate student in our Psych Mental Health Nurse Practitioner program, and Anusha is working on a research practicum where she's looking at vitamin D and how it contributes to emotional health in people of color. I'm not sure, many of us in the United States have vitamin D deficiency, but in people of color, particularly African Americans, vitamin D deficiency is at a much higher rate, and there are implications for depression and diabetes risk factors. So Anusha has been working with me on that research in the biobehavioral lab at UNC. And so I just want to also mention, as Dean Swanson noted, that I'm able to use my research and apply it in a community-based setting. And so one of the things I think is very important about innovation and impact is not only that multidisciplinary collaboration, but community engagement. So when we're designing our studies, is it going to be sustainable? Is it going to be effective? Is it culturally relevant? Is it cost effective? And is it something that is going to really affect the people that we're hoping to affect in the long run? You know, sometimes when we're in our university settings, we have the best of intentions, but we don't know how it's really going to impact the people that we hope to help. And so, thankfully, in the School of Nursing, I'm able to have the opportunity to balance my academic work with my community engagement work and clinical practice, so that I can not only help educate our students and provide clinical sites for them in mental health, but also inform my research with the community work that I do. So I'm very excited about that. So the other thing that I just wanted to mention, I had a couple of quotes that really inspired me as I prepared my talk today. And I thought about, if we're going to be passionate enough to develop the intention to come together in collaboration with others to have an impact on the areas that matter most, what is needed? And so I thought, well, let me take a look at wisdom of heroes and other people who have been impactful innovators. And a couple of quotes I came across, and one was by someone who I'm sure we know a lot about. Her name is Harriet Tubman. Many people have heard of her. We are aware of Harriet Tubman as one of the leaders of the Underground Railroad, but what many of us don't know is that she worked for the United States War Department as a combat leader, a Union spy, and an Army nurse in the Civil War and the Spanish-American War. And we all know, though, that she was quite courageous and that her work was impactful. And she said that every great dream begins with a dreamer. Always remember, you have within you the strength, the patience, and the passion to reach for the stars, to change the world. And as academics, you know, we're very focused on our science, and hopefully we have the time and the wherewithal to remember how much our passion and our creativity will matter in our ability to impact others. And finally, Dr. Mae Jemison stated that we should never limit ourselves because of others' limited imagination. We should never limit others because of our own limited imagination. And that just reminds me to be a great mentor to my student here and the other students that I mentor, because we never know. Their ideas might seem big and almost grandiose, but if we can support them with all of the resources that we have here at UNC, this is a wonderful place for innovation and impact. And if we can remember that the young people who come after us will have ideas beyond what we could even imagine, that if we support them, that it's going to create something that will impact others, not only here in our local and regional areas, but globally. Thank you very much.
Prior to coming to Chapel Hill, she did a little bit of time at University of Maryland until she came to the light and came to Chapel Hill. Last year, while here, she also spent a year as a fellow at Princeton Center for Information Technology Policy, which is housed under the Woodrow Wilson School of Public Health and International Affairs. She is the principal investigator on a National Science Foundation grant where she studies gender, race, and social class in computing careers. She studies the social impact of technology with special emphasis on socio-political movements, social interactions, surveillance, and privacy. She started out as a computer programmer and became really interested in the social aspects and consequences of new technologies and switched to sociology. In addition to traditional scholarly articles, she also writes for popular press, the media. She has her own blog site. She tweets. She has received the best papers from both the International Communication Association and the American Sociological Association. I look forward to listening to you.
Yes, why be stressful following up those two talks? What stress? Why would anybody be stressful? But that was wonderful and fascinating. As she said, I'm Zeynep Tufekci at the School of Information and Library Science. And with information everywhere around us and proliferating and new technologies, it's a great place to study these developments. Not only are we the top-ranked school in the country in our field, when it was revealed that the National Security Agency was collecting Americans' metadata, when everybody was going, what? We're the people that went, oh, because we knew what they were talking about. So I'm going to talk about innovation. I want to talk about innovation in the context of social media, and I want to give one example of a successful innovation and one that failed. And I want to turn the narrative around a little bit, because when we think of technology, we usually think of Silicon Valley as this great innovation place, and other parts of the world as not so great in innovation. That's true to a degree, but not always. I'm going to tell you guys two stories, one in which the great innovation in Egypt happened on social media, and one in which Google flopped. So the one with Egypt is the case study I did as part of my research on social impacts of social media. Was a Twitter account along with a Google spreadsheet and Google document website that popped up during Egypt's clashes about a year ago in November. There were major clashes between Egyptian police and Egyptian activists in an area near Tahrir Square called Mahmoud Street. And it was not minor. I mean, we were kind of following the news. You just know there's a lot of tumultuous and there's a lot of deaths. So it's not a minor, it's just a protest. And during these clashes, many people were getting injured and killed. And in fact, at the end, 34 people, I believe, got killed and thousands got injured. And there were makeshift hospitals. This is a very large area. Tahrir Square is a very large area, and this is this broad area that's at the center of the city. There were people getting injured and killed. And there were makeshift hospitals that were trying to deal with this influx of people getting killed and hurt, and there were doctors and nurses, people who sort of put their service kind of first and said, we're going to go treat these people. But how to coordinate them? How do we coordinate 10 field hospitals, thousands of people? The state is not participating in this because the state is shooting at you. You see, there's a problem when you need to do it yourself. And people turned to Twitter to try to coordinate. So they were tweeting saying, we need more betadine at this field hospital number 3, or they were saying we need nurses and we have this kind of triage problem here. But it was really hard to keep track of what was necessary. There was a flood of supplies. There was a flood of people volunteering, doctors, nurses, people rushing. But it was this chaos, and you just couldn't coordinate this on Twitter because what was happening? It was just this big mess. So in the middle of all of this, a Twitter feed called Tahrir Supplies popped up and said, we're going to coordinate this. And they started collecting all the information, systematizing it on a spreadsheet, looking at making supplies of all the things that were in various field hospitals, the injured people, who was flowing from where. They basically did all the logistics. I'm watching this as this is happening. In fact, at one point, they got into what's called Twitter jail because they were tweeting so much, and so we helped them, a couple of us, get out of there. So I got to know them because I did some, it's usually reserved for celebrities who spam too much, and we're like, no, they're trying to, do triage in a fight, so let's not do this. So what happened, as this was happening, and we were kind of watching, I'm studying and also really worried, I got in touch with them and I said, do you know anything about logistics? They were like, no. Do you know any history? Who are you? They're like, well, we're a couple of people. Well, we'll talk to you later, because they obviously didn't want to talk to me in the middle of this. And I thought, it's probably a good thing they don't know much about logistics, because that is why in Moscow they speak Russian rather than French or German, because that's what got Napoleon. That's what got Hitler. And so the fact that they had no idea what they were attempting, how big it was probably a good thing. So at the end of all of this, where they successfully coordinated, and I watched the supplies, down to the, how many stitches were done at which hospital at times. When things calmed down, I did get in touch with them. It turns out they were 3 students, 20-some-year-old, 22, 23, 24. Only one of them in Cairo. They just worked in shifts. They thought the fact that they weren't on the same time zone was great. And they did this with a lot of sort of people on the ground kind of contributing to it. This was this amazing, innovative use of social media to do something that would have required major institutional work. So I interviewed them as part of my research. And I said, where'd you get the inspiration? I'm still expecting some military history or something. So the kid, 22, who started this says, I got my inspiration from the cupcake store. What? He said there was this cupcake store in Cairo that was using NOLA cupcakes, Twitter, really well. So they thought, if they can use this to sell cupcakes, why can't we use this to coordinate field hospitals? I said, okay, I'm really glad for your ignorance on this topic. I did not say. But in this case, new technology plus this just can-do spirit had done this very complex logistical innovation, and we're seeing this. We're seeing this now in big and small. We're seeing this in presidential campaigns. We're seeing this kind of coordination from the grassroots in ways that just would have been very, very hard before, happen again and again. So that's an example of a successful innovation that came out of new tools, a little bit of ignorance on the possible, a sort of benign ignorance, and just so young people thinking we can do this. The example I want to give of something not really working is Google Buzz. So Google decided to build its social network and realized that Facebook, where everybody was already on, it would be really hard for them to get people there. So what they did was they looked at people's email, Gmail, because so many people use Gmail, and decided to look at who speaks to whom network and make everybody visible to you. So all of a sudden, everybody you emailed was put in a social network, and everybody you emailed could see whomever else you emailed. That is metadata. And Google thought, we'll just make metadata visible to everyone. What could go wrong? Well, here's what could go wrong. All of a sudden, people who were hiding from their abusive exes and had emailed with them, their emails, current emails, were revealed. This is incredibly revealing. That is why when the surveillance about metadata came up, we were the people who went, oh. So what Google needed was to get out of its just engineering and technology, we can do this. Sometimes the can-do spirit is harmful if you also don't have social science people, humanities people, if you just go with technology and you're not thinking, where is this going to lead? In fact, what Google needed was our students. Because after I explained metadata and I had a class on NSA and all of that, and we talked about all of this, as I was leaving the class, one of my students came up to me and said, we're turning in these reaction papers. Every week they turn in reaction papers on Sakai. Should we post them at night or in the morning, before the deadline? I said, I don't really care. You can post it either before you go to bed or in the morning, either way, as long as it's before class. So my student stopped and said, but then you'll have metadata on all of us on our sleep patterns. I said, yes, yes. And if Google had hired, this is a first-year seminar, first-year student at UNC, he could have told them metadata is powerful. Don't just think about the engineering. And I think the story here is innovation can come from, innovation comes from the ecology. If you try to control it and just go with the technology, and then Google got fined, it's under FTC, it's got privacy fines, there's a lot of price it's paying for this, and its social network flopped, so that was a major problem. So if you try to think of innovation as something like a formula, A plus B plus C, it really doesn't work that way in the wild. Again and again, we see innovations flopping because it's too narrow, and we see innovations flourishing from all sorts of unexpected places, and I think the kind of interdisciplinary, sometimes open-ended, sometimes frustrating, and sometimes difficult work we undertake at UNC is exactly the kind of environment where great innovations can succeed. And yes, some will flop. I think that just is the price of the ecology that creates great innovations. Thank you.
Wow. Wow, one word, innovation, and look what it sparked. Questions from the audience? Then without a question from you, I'm going to ask one. What I've noticed about each of you is that you are sitting at the intersection of at least two disciplines that brought you into the work that you are currently doing. So I'm going to ask, what is it about you that made you bold enough to leap out of one discipline and sit in another and try both places out?
Did you say ignorance at one point, right? Ignorance of the possible?
Because there's bold risk-taking to go from a comfortable place to a place where, what the heck, give it a try, I'm going to fit here probably.
Oh, sure, I'll go first. Well, I think it was the problem that confronted me. So, air pollution and its connection to public health covers so many different areas in so many different ways and touches our lives in so many ways that it's impossible to go after that problem unless you have interdisciplinary. So I knew it was a problem that drove me to that. And so if I wanted to tackle that problem, I had to learn the language of toxicologists, learn the language of business. And that is actually the biggest obstacle between these things. We had a vehicle for us in the engineering world is a real vehicle, but a vehicle in medicine is a way we deliver things, right? And so sometimes two words have the two different meanings, and we end up talking to each other and over, so it spends a lot of time doing that. So.
Thanks for that question. So as was mentioned, I started out in the field of psychology and was definitely sure that I wanted a doctorate in psychology. But my first semester in my PhD program at Stony Brook, I was working on research on stress and its contribution to adverse birth outcomes. Science shows that stress contributes to low birth weight and preterm delivery. And so I was working on my advisor's research at that time, and our role as research assistants was to sit in OBGYN clinic and interview pregnant women to learn about stress. So we did that 3 times during their pregnancy. And sometimes they'd miss appointments, and so we'd just be sitting in the waiting room waiting for the women to come. And I got to observe a nurse practitioner interacting with her patients on a daily basis. And so in psychology, I was learning about social theory, social interactions, health psychology, and how those things contribute to adverse birth outcomes. But when I got to sit in the waiting room and observe how the patients interacted with their healthcare provider, I realized that was a piece of a perspective that I was missing only in psychology. Psychology is a great field, but for me personally, I wanted to have that proximal relationship with the people that I wanted to help. And so I was able to stay in my PhD program in social and health psychology while also pursuing a degree in nursing. And while I worked on my doctorate in psychology, I worked as a nurse in med-surgical units, in hospice care, in psych mental health. And so those 2 disciplines helped me to not only come up and design good research studies, but also to understand how my work would, where the rubber meets the road, basically. And so that, I think, has been very important for me in the work that I've done. So it was a lot of work, but it was one of the best decisions I ever made.
So we have like 1 more minute. So Zeynep, how about for you?
Well, obviously, the ignorance part helped. But more than that, as a programmer, these things have never been black boxes to me, but I realized to a lot of people they were black boxes, the computers, but they were having all these social impacts. And I was really driven by noticing they were going to have all these impacts, but that it was hard to think about them if you were only thinking about them from one side. You had to think about it from many, many angles. And if I had to say one early influence, I would say literature was a great influence for opening up my mind to looking at a problem from many, many different angles, the technical, the human, the social, and that's what I try to do in my work.
We have 1 quick question, because I know we're ready to get to the next room.
One quick follow-up. Can any of you think of 1 or 2 things this university could best do to support that interdisciplinary context for the ecosystem in which you try to work?
I'm an untenured person yet, so take everything I say with a huge grain of salt, but I feel very supported. To be honest, I feel this is why I came here. I feel like this is a school, it's now in the guidelines for our tenure. I feel that it's valued. I'm affiliate faculty at sociology. I have friends at journalism. I've got friends at law school, so more, and tenure us.
I would agree. I feel tremendously supported. I'm affiliated with the program on integrative medicine. I'm part of the SHRE Institute, which is the Center for Health Equities Research, NC Tracks, and the CTRC. All of those things provide us with the opportunity to work with other disciplines and provide us with the resources to write good grants and to carry them out.
Yeah, I tend to agree as well. I mean, you know, in our department, we very interdisciplinary, even within our own department. You know, I think maybe one thing UNC could probably do more is advertise. I think students love
Yes,
being
they
able to work in interdisciplinary projects. I think they crave it, they want it, they live in this world, these new students, that they look forward to it. And it's always been a big draw for the students that I talk to that say, hey, yeah, you might be working with this chemist and this person from the School of Medicine looking at this and building an instrument. And they're like, oh, that's great.
Absolutely.
Please join me in applauding this group.